Greetings from TV AIBD. You are with me, Philomena on Connect with AIBD, and today we're talking to an expert from the All India Institute of Medical Sciences, or AIMS. He is the director of AIMS, none other than Dr. Randeep Guleria. And I think in India, the moment people hear the name Dr. Randeep Guleria, you're making waves, doctor, especially during this pandemic. You are a member of the National Task Force for the Government of India and monitoring the entire situation and ensuring that India progresses well. Thank you for being on our program, Dr. Randeep.
Thank you, Phil.
And Professor, you are an expert on respiratory diseases, and I just want to ask you, how does SARS-CoV-2 differ in terms of pathology compared to other respiratory viruses? Now, how is this different, Dr. Randeep?
We know that this comes from the corona family, and there are 7 coronaviruses in this family which can affect humans. 3 of them cause serious disease, the SARS-CoV, MERS and SARS-CoV-2, which is now the COVID pandemic. 4 of them cause mild symptoms like cough and cold. But how is this different from influenza or the common cold that we see? And we've had one pandemic of H1N1, which was also known as swine flu in 2009-2011. Although this is also a respiratory virus, SARS-CoV-2 is also a respiratory virus. It starts with cold, cough, body aches, and then the virus travels down into your lungs, causing pneumonia. But this virus also causes effects in your blood vessels and leads to what we call endothelitis, or higher chance of your blood vessels getting inflamed. Therefore, there is a higher chance of clotting happening, and this can lead to other organs besides the lung getting involved. People get heart attacks, they have brain problems, and then it leads to dysregulation of your immune system, which is also known as cytokine storm. So the virus goes away, but it disrupts your immune system of the body, and then you start getting more multi-organ failure, not because of the virus, but because the body's immune system is now hyperactive, and it starts causing a self-destruct phenomenon. Thirdly, what we realize now, as we have gone along the pandemic, is that although you get all right with the virus leads certain changes in your body, which leads to what we call post-COVID or long COVID, which affects people in the form of chronic fatigue syndrome, brain fog, body aches, breathing difficulty, chest pain, and causes sometimes damage to various organs, including the heart, the lungs, and the brain itself.
So there you go. This is something which totally is, I think, very much different, because in the case of many viruses that have emerged throughout the world, this is like 18 months. We've now entered into 18 months. And doctor, even as you look, so many countries are still under lockdown. They open up and then there's a lockdown. The same thing is happening to where we are in Malaysia. I'm sure it's happening in India as well. In Malaysia, we are still under lockdown, and chances are we might be going into this situation till the end of the year. And COVID cases are rising. Like at one time when 100 cases were like pretty odd, but today we have 17,000 cases of COVID and more deaths actually. So I just want to know why this is happening. I mean, the virus seems to mutate. You had one variant, and now we have this new thing called the Delta variant. Now, what is happening in the sense that it doesn't seem to be controlled?
2 or 3 things. One is that we still have a susceptible population. Remember, this is a novel virus. This is a virus to which mankind has never been exposed. So everyone is susceptible unless either you have the vaccine or you've got the infection and your antibodies are there. So we still have a large proportion of population which has not had the infection or got the vaccine, and therefore they can get the infection. Secondly, the virus mutates, and we know that this virus tends to mutate regularly. On an average, it may have 2 mutations every month. Many of the mutations are just variants of interest. That is, they mutate, but the virus does not cause any effect as far as humans are concerned. It doesn't become more infectious. It doesn't mutate to cause more deaths, or it doesn't mutate to cause what we call immune escape mechanism, so that reinfection becomes high or the vaccine loses its efficacy. But there are times when the virus mutates, and then it becomes what we call a variant of concern. And we've had the alpha, the beta, the gamma, the delta variants, all of these have become variants of concern. And currently, we have the delta variant, which is now becoming the dominant strain across the world. This variant has the ability to quickly attach to the receptors in our human cells, especially in the nose, throat, and the lungs, which are known as the ACE2 receptors, and it can infect very quickly. So even a mild exposure leads to the infection. And what we were seeing in the first wave last year, when the Delta variant was not there, that in a family, one or two people are getting infected, the others will not get the infection because of the fact that this virus was not that infectious. But now, what we're seeing with the Delta variant is that the whole family gets infected. So, this is a variant which spreads very quickly and therefore is causing this huge surge in the number of cases in many parts of the world, including Malaysia.
Thank you, Doctor. I think the whole world is in fact talking about the Delta variant. And sometimes I wonder whether, when you say Delta, the automatic thing is to think about India, that part of the world. But some people may never have been there. But again, human travel and human contact, I think, is the main issue here that is causing the wildfire spread of this particular virus or disease, to be more specific. And sitting as a member of the Scientific Advisory Group of Experts, or SAGE, some time back, or are you still in this working group of WHO?
No, that was during influenza time, during the pandemic.
I see. I said, okay, so you've done quite a bit, and the world has seen multiple influences. Okay, let's come back to India. Right now in India, you are the member of the National Task Force, and if we look at India, more than 30 million people have got COVID, and 400 plus people, I think, died of COVID, to be more precise. Now, what were some of the ways India managed to cut the death rate? With 30 million people being infected, what was being done actually, Doctor?
So you're right. We have a huge population. We are almost 1.3 billion people. And if you look at our people who have got COVID per million population, or the number of people who died per million population, the number is much less as compared to the developed world. So what we did was, very early, we realized that we have to have a multi-sectorial involvement, and there has to be a sort of a distribution. So the government created what is known as COVID care centers, COVID hospitals, COVID ICUs. So those who had mild illness and did not need a lot of management were actually managed in a COVID care center, which could be run by healthcare workers with less training. But those who saturation fell or who had moderate illness were then treated in a COVID hospital, and those who had very severe illness went into a COVID ICU. And with that, we were able to distribute our work. And then there was a lot of aggressive activity done in terms of surveillance. Remember, it's not only the treatment part that is important. It's also important to prevent the spread of infection. So having containment zones, doing what we call testing, tracking, treating, and then isolating people is very important. This is a virus which spreads from person to person. It's a human to human spread. The virus cannot spread from one person to the other without human contact. So if you are able to have COVID appropriate behavior, if you're able to maintain physical distance, if you are able to prevent crowds which can be be super spreading events, we can prevent the spread of infection. And that was done in many parts of the country. It's a huge country, and therefore the pandemic also moved from one area to the other, and we had to develop strategies of managing in different parts of the country.
So, Doctor, you said that, most of the patients sort of end up in ICU, and all of them, probably most of them who are displaying certain kind of changes or reaction, they're being treated in COVID-19 wards in the hospitals, where a large number of people, this is happening in Malaysia. We don't even have a place for people who have COVID-19. They are asked to be quarantined at home, and then when you're gasping for air, I guess it's the same everywhere. When you're gasping for air, then you ask people to admit themselves, and then your oxygen level sort of goes down. The other big issue that we're looking at is people, there are so many variants. If I'm talking to you, the Delta variant is one, but just a while ago you were mentioning other names as well. Now, what happens when you put these people together? You have a Delta variant, you have a Alpha, or what else? Is this not going to cause further damage?
So this has been a cause of concern at some point in time, that can there be a reassortment of the virus? That is, if two different variants come together. Luckily, in humans, that doesn't happen. It does happen in animals to some extent when two different strains come together and they become what we call a reassortment vessel. Secondly, in most areas, you have only one strain which is dominant. So if you have Delta variant, then the Delta variant becomes dominant and gradually the other variants don't circulate in that area. And therefore, chances of too much of mixing of one variant with the other becomes less. Because over a period of time, as we are seeing now with the Delta variant, it has now become the most common variant. And if you look at surveillance data, what they're picking up across many countries is just the Delta variant. It started off with a different variant. For example, in India, in certain parts of India, in the beginning, we had Alpha variant, which came from the UK. And then when the Delta variant emerged, it started becoming so dominant that now we hardly see the Alpha variant. We are seeing mainly the Delta variant circulating in our country. So the chances of mixing are less. And in humans, this type of reassortment doesn't usually happen.
Okay, so I think that's consoling to a certain degree. But what is not consoling is that you see people who have actually been vaccinated. Now, we have a lot of cases of people being vaccinated, maybe dose 1, dose 2, and they still end up getting COVID. And then they die of it. There have been some cases of deaths as well. So why does this happen? I mean, isn't it supposed to bring down the efficacy of the vaccine? Actually, does it actually work on individuals, doctor?
So the data that we have is that the vaccine is working, but it works against preventing serious illness. So the vaccine at times cannot prevent infection, but it can prevent serious disease. Now you must understand the difference between the two. What it means is that you may come when a person who's vaccinated comes in close contact with a COVID positive person, he can get the infection. The virus may be present in his nose and throat, and he can also be infectious and give others the infection, and his RT-PCR test will be positive. But because he has antibodies, due to the vaccination, the antibodies will not allow the virus to multiply and grow in his body, and therefore he will get a mild disease only, or he will be asymptomatic, and he will not land up with severe disease going into hospital or dying because of COVID-19. This happens with majority of people. There would be some exception that someone may also get severe illness because he may be immunocompromised, the vaccine uptake may be less, or he may be having an underlying disease which makes the COVID infection more severe. But by and large, whatever data we have suggests that the vaccines actually help severe disease. And we are seeing that to some extent in the UK. In the UK, we are having a huge surge in the number of cases, but it is not reflected with the number of hospitalization. The cases have increased, but the number of people getting hospitalized because of COVID has not increased. Neither has the death increased. That means you're getting more cases, but because of vaccination, you're getting milder illness and you're not getting that severe disease. So that is important to keep in mind.
So that is food for thought. And also, I think now with the different kind of cocktail vaccines that are being, brought, people are talking about it, maybe encouraging this to also allay this kind of mixture of variants. Now, what do you think of these this method of cocktail vaccines, doctor?
So there are two things. One is, can we do what is known as heterologous prime boost? That is, you give the first vaccine of a different platform. You give it like these, let's say the AstraZeneca vaccine. And then the second dose, you don't give AstraZeneca, you give the Pfizer vaccine. So that type of mixture has been tried, and some data that may suggest that it may give you more immunity. The second is that you take the AstraZeneca as the first and second shot, but later on as a booster, you take up the Pfizer or let's say the Moderna vaccine. That has also been looked at, whether it will give you more immunity. So that studies are on, but there's also some people who are looking at what people do with influenza. For example, the influenza vaccine is a quadrivalent vaccine. It covers 4 strains. So can we have a vaccine which is going to cover, let's say, 2 or 3 of the variants, and it will provide you immunity which will give immunity against multiple variants? So my own feeling is that in the next few months or the next year or so, we will see new generation vaccines coming up. which will be more effective, which will cover for variants, and will be able to provide us better protection. What we currently have is the first generation vaccine, which were made in breakneck speed. They were done very well
Yes.
with all the scientists coming together, researchers coming together, industry coming together. But as research moves forward, we should be able to get better vaccines, and second and third generation vaccines will emerge, which will actually be even better and provide us better protection.
So I guess we're talking about testing the efficacy of the of the vaccine as we go along, while the virus keeps mutating. And today we're talking about the Delta variant, but we don't know that whatever we're taking can fight. But you said that it can help to contain or maybe not make things worse. But however, vaccines, more and more new vaccines should be coming up, like you mentioned. Doctor, in most cases of diseases, if you look at any kind of pandemics before this, people always get a vaccine and then they develop an immunity, and then you don't get that particular illness again. You don't get that again. You don't get the disease again. But in the case of COVID, people can still get despite being vaccinated, or there's still a need for booster and so forth. Why is this so, doctor?
So this happens with some viral infections, depending on whether they mutate or not. So there are certain viral infections where you don't need to take a booster, and you take the initial and you get immunity. For example, people who get measles, once they've got measles, they usually don't get it again. But then you have other viruses which mutate. Classical example being influenza. We say that every year one should take his flu shot.
Influenza
flu shot is on an annual basis because the virus undergoes some change which we call an antigenic drift. The virus changes every year. Based on that change or the mutation that the virus has, the new vaccine is made every year, and every year those who are more susceptible to get severe influenza infection are asked to take the flu shots on an annual basis. So in a similar manner, as the virus stays here in our among humans, it's likely that for the higher risk group, the elderly, those with comorbidities, we may start looking at an annual vaccine for COVID, which people may have to take in the coming years.
Doctor, we have seen a huge, most of the case, at least what we're talking about, most of the cases which are affecting different age groups of the population. For instance, those about 20 or 30 or something like that. Now, there is this thing that people are saying that the next wave of COVID will hit the children. But still, people are apprehensive. Like, for instance, in some countries, certain vaccines were supposed to be given to children, but they were afraid of myocarditis or other health, problems. So vaccines have been withheld from children. Now, what's your thought on this? Is there a chance that that's going to be a third wave of hit on children?
So the data doesn't support it. If you look at the data that is available both in the waves that we've had in the past and currently, children do get COVID, but they get a mild illness, and most children who get COVID usually recover without having to come to hospital. And this is supported in our country by what we call a sero survey. When the sero survey was done in our country, it was found that more than 50% of children who blood sample was taken already had antibodies. That means they had already had COVID and had recovered with a mild illness. Also, when we look at admissions in the hospital, we find that in compared to adults, very few children get admitted with serious COVID, and they are the ones who have comorbidities. Therefore, I don't think that in the next waves you will see children getting affected. Having said that, it is also good that we have vaccines for children, and there are trials which are already on. Pfizer vaccine already has got approval by the FDA to be given to children. In India, there are trials going on for vaccination between 2 years to 18 years. And we're hopeful in the next few months, the trial will be over and we'll get the approval that we can give these vaccines in children also. So I think that maybe in the next 3 to 4 months, we will have vaccines available for children. We should be able to give it to them. But I think we should not fear that children will have severe COVID and the next wave will only affect children. That will probably not be true.
The thing is, how would we not live in a crowd? If you look at India and its festivals, or and the way people actually move around, If you look at the malls today, if you walk into any city now, I think you are walking into ghost towns. Or most of the malls are closed anyway, except for essential services. So are we saying that we're looking at that? Because how else would you avoid crowds? And how long will people have to go on like this? Is there a light at the end of the tunnel? I know there's no time period, but will this just disappear in a bit? Hopefully.
It will. There is light at the end of the tunnel. It will gradually disappear. And I think two very important things are there. One is, like I said, more and more people getting vaccinated and new generation vaccines coming up. There is now, like I mentioned, UK and data from the Western world that once large number of people get vaccinated, at least serious illness becomes much less. The strain on the hospital becomes less. And you may then have COVID as a mild infection causing just fever, cough, and cold, and only few patients really getting serious illness. That is something that one can live with. Secondly, you have to look at how cases are in that area. If you find that the positivity rate is low, your admission rate is low, you can then develop a strategy where you can allow opening up, because besides livelihood is also important.
Yeah.
So you have to be able to have a lot of activities which are important for people to sustain their livelihood. So that has to be balanced out. And that can be done by developing different strategies based on your case positivity rate and the hospital admissions that you're seeing in that area. So that's, like I mentioned, you have to do a very close surveillance. In an area which is doing better and their people are good and careful, allow gradual opening up. Where you're seeing a huge surge in the number of cases, quickly clamp down. And if you do that, then you would be able to balance the two things.
Doctor, you're a sleep expert. Now tell me, many people who've had the vaccine, they complain that they can't sleep, they spend sleepless nights. Other people say they're very sleepy. Now does sleep actually help towards this? You talked about human immunity and being a sleep apnea expert, basically. Does sleep really help, in these kind of infectious situations or disease? Doctor?
Yes, so to recover from viral infections, a good sleep hygiene is very important. What does that mean? It means to have regular sleeping habits, not take stimulants before going to sleep, have a good environment which is conducive to sleep, get at least 7 to 8 hours of sleep every day. If you're able to do that, it allows your body to recover faster, and therefore it's very useful even after COVID, that you get your rest and you let your body to recuperate and come back to normal. So I think a good sleep hygiene is very important as part of recovery from most viral illnesses.
Thank you, Dr. Randeep. I'm talking to Dr. Randeep Guleria, and he is the director of the All India Institute of Medical Sciences. And we've been talking about COVID-19 and where the world is heading to, and the different strategies that need to be in place. Thank you so much, Dr. Randeep, for being on our program. Thank you, Doctor.
Thank you. My pleasure. Thank you.